Hi everyone, my name is Trace and I am a second year nurse practitioner student, and today I'm going to be looking at a simple interrupted suture, which is the most widely used suture. Okay, so this is my model that I'm going to be working with. Also hemostat to hold the suture. This is the suture using a bicryl, which is one of the absorbable ones, and then the scissor to cut the stitch and the tweezer to hold. Cleaning agent, which is going to be alcohol. Obviously, you can use chlorhexidine, betadine, and pair of gloves. We'd prefer sterile gloves since if it's a wound, more likely it will be a sterile procedure. Okay. All right, so here we have our hemostat. We're going to place our fourth finger and our thumb into the hole. Then we're going to grab a hold of our suture, taking care to close the hemostat, because when you do that, it helps you to have a more sturdy hold on the suture. Then you're going to hold the suture up to, or the needle up to a 90-degree angle before going in. Then you poke the skin. You're trying not to go too deep because we want to be just below the dermis. And then you take an equal amount from both sides. You use your tweezer by holding it like a pencil, and then you use that to aid you to take out the suture, the needle, and then you can extend your suture all the way, making sure to leave a bit of tail to work with for when you are about to form your knots. So again, you use the hemostat, you put it in the center, then you're going to loop around 2 times the vicryl suture. And this is to help you form the surgeon's knot. You pull in the tail, and you're taking care to lay the suture flat so you have your hands crossing over each other, so the tail is now on the opposite side. Try not to pull the suture too tight on the skin because you don't want to traumatize the skin. And then this time we're just going to go for one loop around and then cross over on the other side. So far, doing good. And then you can do this about 3 to 4 times a single knot just to secure the suture. This one has been a little stubborn. But we will eventually get there. There we go. And then I'm just going to do this one more time. And of course, it will take a lot of practice. This was my first day doing the suture. Lay it down. And we are going to go ahead and use our scissors to cut away the excess. Not too short, because you want to give yourself some room for when you want to take the sutures out. There you go. Voila.